It is World Blood Donor Day, and we're glad to have you all on. This is our news conference to share info on what is happening with our local blood supply this time of year, and of course, why we've set aside June 14th as World Blood Donor Day. This is the date of birth of Dr. Karl Landsteiner, who is the researcher who identified that there are different blood groups. He was born in Austria and worked around the turn of the century in this area and was able to identify that there's a type A, which is my blood type, a type B, a type O, and a type AB, and also identified the Rh factor in blood. So blood centers actually all across the globe recognize June 14 as World Blood Donor Day. It does come during a time of year when blood centers in our part of the world face challenges with the blood supply. That is due to, in part, the school year ends, and our big blood drives that we have at high schools, colleges, and universities are no longer on our schedule. My colleague here, Amanda Hess, will have more to say about factors that influence blood collection. But it's also a time of year when hospital emergency departments talk about this period between Memorial Day and Labor Day as trauma season. Of course, any day of the year, you could have accidents out on the road, or even violence or workplace accidents that lead to blood loss. But as the weather warms and people are out and doing more, the hospitals do find an increase in the demand for blood due to trauma. Here in our region, we saw in May a terrible traffic pileup on an interstate in central Illinois due to a dust storm that occurred. And then more recently in Davenport, Iowa, the partial collapse of an apartment building, both reminders that it's important to keep a strong and stable blood supply year round. So that's all that we have. We have a lot to cover. I want to ask Amanda Hess, who's our Vice President, Donor Relations and Marketing, to take it from here. For our folks in the media, by the way, we are recording this today and invite you to record also in your own production studios. We'll post a recording at bloodcenter.org/news as soon as we can after we're done. But we'll have a couple of speakers here and then move into questions. So go ahead, Amanda.
Thank you, Kirby. Happy World Blood Donor Day, everyone. We love celebrating this day because our donors are really at the heart of everything that we do. Kirby's right. Between Memorial Day and Labor Day, we are more challenged. In general, only about 5% of the population gives blood to begin with. So we have our work cut out for us to make sure that there are safe blood products used for transfusions for patients for all kinds of things. Kirby articulated that well. But summer is a challenge because normally we see around 3,600 donations every week, and that drops by as much as 20% depending on the week during the summer between Memorial Day and Labor Day, especially those immediate weeks surrounding the holiday. But really that entire period, we see a significant drop. Just for an example, last week we saw less than 3,000 donations. And when we normally see 3,600, you can imagine how challenging it is to make sure that the right blood product of the right type gets to the patients when they need it. Blood has a very short shelf life. Red blood cells can be transfused within 42 days, platelet products even less, 7 days. So we're constantly moving blood products around to make sure that they get to the hospitals when they need them. We do ImpactLife is a not-for-profit regional blood center, and we serve hospitals in Iowa, Illinois, Wisconsin, and Missouri. So we provide blood to our local hospitals from local volunteer donors. So the 3,600 donations, it has to come from within our communities. And that goes back to our patients in our communities. We do have those situations where there are peaks in use of blood. And so we always have to have extra on the shelf to be able to accommodate when a disaster or a crisis occurs. Every day when someone needs blood, it is a crisis for that individual and for their families. But then there are times when there is a lot of blood needed, either for one person or multiple people. And that's what makes it a real challenge in the summer. Right now, we're sitting at a less than 3-day supply for type O red blood cells and B negative, which we strive for at least 5 days supply on hand of all the blood types for red blood cells. The needs for platelets are daily because of that very, very short turnaround time on those products. And I would just say, if every donor looked at this as just a part of life and something that they can do to support their community. Routine donations would prevent us from having blood shortages. Right now, less than about 70% of our donor base gives only once or twice a year. So 70% of the volunteer donors we rely on only give once or twice a year. If we had more donors that would give every 56 days as they're eligible as part of their lifestyle, it would make a huge difference and would create that stability, that cushion that we need for those crisis situations. So I really, truly, if you take nothing away from this, want to show gratitude for our volunteer blood donors, because it can't come from anywhere else. It has to come from volunteer donors. And this day is really about celebrating those heroes, those volunteers. It's the blood that they gave yesterday and the week before and even last month that is what saves a life tomorrow if something bad happens. So they do that not knowing who they're going to help. We do have a great Thank the Donor program where patients can give little thank you notes to the donors that gave their unit of blood. And we are able to share those stories on our social media channels at ImpactLife Blood. So would encourage anybody who's interested in seeing some of those great stories to follow us on social. And then volunteer blood donors, you can actually schedule your own appointments online at bloodcenter.org, or we have an app. And our donor schedulers are always on hand 7 days a week to take calls. And for donors that maybe want to try it for the first time, they are wonderful and can walk you through the process, but it's 800-747-5401. So thank you to everyone supporting World Blood Donor Day. Thank you to our donors. And I'll turn it over to Kirby to hear from some of our medical experts.
Thanks, Amanda. Yeah, Amanda and the recruiting team bring in more than 200,000 donations annually. This is donor centers, mobile blood drives. So we have great support out there. We just need it on a very consistent basis, right? So we have two other speakers. Dr. Daniela Hermelin is the Chief Medical Officer for our blood center. Dr. Hermelin joined us formally about a year ago and has direct experience working in a major trauma center laboratory or blood bank at a hospital. Worked with ImpactLife in that capacity at St. Louis University Hospital and Cardinal Glennon Children's Medical Center. And now is on our side of that relationship as Chief Medical Officer for ImpactLife. And so Dr. Hermelin, I just want to invite you to talk about trauma season and the reasons that the use of blood is it's always important, but what's different this time of the year.
Thank you, Kirby and Amanda. That was just so eloquently stated, all the different reasons that we do need blood right now. And yes, going back just a year ago, I was on the other side of the curtain, and that was being the medical director of transfusion service for St. Louis University Hospital, Cardinal Glennon. And being on call the night of Memorial Day can get your blood pressure going. We don't joke around. It's a serious thing in the hospital. Trauma season does start on Memorial Day. And that's when we see, unfortunately, different types of traumas happening, lots of celebrations happening. So, with that, there can become a lot of motor vehicle accidents, motorcycle accidents, unfortunately, drownings, and other such types of traumas where there's massive bleeding that occurs. And when that happens, we have patients that come to the hospital requiring large amounts of blood. And so in reviewing these day to day, I have seen that trauma season starts at Memorial Day, kind of ends at Labor Day, And we see a little bit of a bell-shaped curve in blood utilization. We see the need for more blood products during this time. And I remember kind of actually increasing our blood usage, going to ImpactLife and requesting for a little bit more blood during this time period. And that's to really cover the needs of the patients that are coming into the hospitals during this time. And you know, my colleagues who are really in the ED, who are on the floors, who are in the OR, and hopefully you're going to be hearing from somebody, one of our trauma surgeons, there's probably nothing more scary in life for a surgeon not to have access to blood for their patient. And I've heard that fear in their voice. I know what it's like when there is a patient in the trauma bay. They need blood now. They need to transfuse, and they usually need lots of it. And I was always so grateful that ImpactLife was able to supply us with a certain amount of blood to be able to cover our trauma resuscitations, because when it's needed now. It's critical, it's urgent, it's essential. And I've seen how having blood on the shelf, and at SLU, we actually were able to add blood right in the trauma base. So the trauma surgeons turn their shoulder, they open up a refrigerator, and blood is available to them to actually transfuse right there. And we also added blood to the OR refrigerators also, so when the need is there and they're bringing that patient from the trauma bay to the OR, they have blood readily available to them. And again, just the need to have blood, have it accessible so our trauma surgeons can provide that trauma resuscitation is essential. And during this time, we have a greater need. So I want to thank our donors today, World Blood Donor Day. It's actually a global celebration. And I just want to thank our local donors, though, for supplying the blood to our hospitals. Thank you. What you do is truly life-saving. So Kirby, feel free to ask me any more questions that I haven't been able to answer.
We will. I love how you put it about, they open the refrigerator in surgery, in trauma, and the blood is there. Because we see on our side of it the donations being made, and that just gives an image of where they end up and how they're used in those critical moments. We have also with us Dr. Linda Jones, and by the way, we'll have a round for questions here in a few minutes after we're done. Linda Jones is Vice President for Ancillary Operations with Memorial Health System out of Springfield, Illinois. And she also knows what that side of the equation is like. How is blood used in trauma? What is the need for blood? Really for all of those other reasons that we think of as normal and routine, but of course that they're never normal and routine for the patient. We're talking about cancer, other types of surgery. Sometimes blood transfusions are needed when there's complications related to childbirth. And so Linda Jones, again, from Memorial Health System in Central Illinois, could you please go ahead and share your remarks on use of blood, what happens this time of year? Thank you.
Thank you so much. I appreciate the opportunity to partner with ImpactLife, not only today on World Blood Day, but every day of the year. This is an important relationship for our physicians and patients who need blood products. You've already heard Kirby talk about that the most common patients needing blood are those who are having surgery, who have a diagnosis of cancer, or who experience a trauma. And trauma is the #1 cause of death for individuals under the age of 45 in the US, and results in over 150,000 deaths in the United States every year. It's unbelievable when you see the nationwide scope of this, but 41 million visits to emergency departments in the US are caused by trauma every year. And 2.3 million of those people need admission to the hospital. 15 to 20% of trauma patients require transfusion, and 3% of those require what we call massive transfusion. I'll talk about both of those in a minute, but first just to say that transfusion medicine has changed incredibly over the past few years, especially in the last decade, as we've become more aware about the importance of the different components of blood and how to use those in a situation of large blood loss. An individual can actually bleed out and lose almost their whole blood volume in 5 minutes in a situation of trauma. So immediate response just out in the field by our emergency teams that are transporting patients to hospitals, and the ability, as Dr. Hermelin talked about, to respond quickly and immediately in the emergency room is very, very important to individuals' survival. So it used to be that we thought about red blood cells as being the most important blood component. But when you're having rapid and large losses of blood, it's very important that we balance the components of blood and give people all of the different blood products that can help get them back to a static state. So certainly red blood cells are the backbone of transfusion because they're so important to us in terms of transporting oxygen and maintaining blood volume. Plasma, though, which is the liquid part of the blood, is also important to us and adds in terms of helping us maintain the blood volume as well as carrying other important components of the blood that are important in oxygen and nutrient transportation and also in immunity. And then the third component that is often used in transfusion are platelets, which are critical to blood clotting. And that's where in the individual who's losing a lot of blood and getting replacement blood products, it's very important for us to be able to assure that their blood is going to be able to clot appropriately, because it tends to become more liquid, less likely to clot when you're having a rapid turnover of those blood products. 3% of individuals who get transfusion from trauma require what we call massive transfusion, or what we shortcut to call in hospital the MTP, the Massive Transfusion Protocol, which has been defined over and over again now by our emergency medicine and trauma specialists, where we're balancing those components I talked about to usually a ratio of 1:1 or 1:2, where for every red blood cell component, you also need platelets and plasma. You heard earlier that the local blood supply dropped by 600 units in just 1 week in terms of our donations. In a massive transfusion protocol, you can use up to 100 units of blood products. So critical supply for us in the summer, for us to have enough of these components available to really give patients the best care at the bedside and immediate resuscitation. They're in life-threatening situations, and every unit you donate makes an important difference. Believe it or not, while I was sitting here waiting to be talking to, I saw my cell phone ring, and it was the 800 number from ImpactLife trying to solicit me as a donor. And I can tell you, if you practice gratitude in your life, there's nothing better than the feeling of having spent 45 minutes of your time and walking away knowing that you could have saved 3 people's lives by that 1 unit of blood that's being broken down into those blood components. So it's really valuable for you personally as well to be a blood donor and know that you're helping others.
Dr. Jones, wow, that's really something you got a call from our scheduling team
I did.
just on the day. I guess we know they're always at work, and trying to fill those schedules. It's hard work because of that percentage of people who are eligible to donate. It's not just everyone, and those who have experience as blood donors is a smaller percentage still. I'd just like to go ahead and invite any questions if folks want to either unmute a microphone or submit questions via chat, and wonder how else we can help media with any coverage on blood supply today. And also, of course, thank you for joining us. So go ahead and submit those, and we'll just take a few moments. If there aren't any, then I'm going to come up with some questions.
I have one if I could jump in. Jim Leach at WMAY in Springfield. It was mentioned earlier that only 5% of the population donates. Do you have any figures overall as to what percentage of the total population is going to require a transfusion in the course of a given year? How do those numbers match up, and how do they change during these summer months?
Wow, that's a good way to put that question. The comparison of about 5% of those eligible to give do, and then what one way I think to look at it, and I'm sure others will jump in with a better answer, is that anyone might need a blood transfusion, on the basis of either a new diagnosis or a trauma. Even just yesterday, this didn't turn out to be anything, but a car came right through a stop sign, and I slammed on my brakes, and we missed, and they kept on going, and I went about my day. But we weren't very far apart, right? And so that kind of a notion. But Jim, that's not really an answer to your question about the percentage of people who might need a blood transfusion. So Dr. Jones, Dr. Hermelin, Amanda, any numbers on that you have available or could share?
I don't have actual numbers. I think it's a great question, but I also think people need to realize, if God forbid someone needs to come to the hospital because of major blood loss, they don't need 1 unit of blood. So it's not going to be a 1-to-1 either in the setting of shock and blood loss. So even if we came up with a number to say that, per million people during the summer, this many sustain a trauma that require blood products, that one person may require 3 units. In those situations, it's not always a 1-to-1. It's really our chronic hematology oncology patients that I think those numbers might be more apparent to us, because we can kind of guesstimate how many units are required in that population, or even our chronic, patients that have liver cirrhosis and GI bleeding. That might be a little bit easier, but in terms of trauma, like I said, it's not going to be 1-to-1.
We do have a statistics guide, so we can actually, that was created by a national association, ADRP, so we can make that available too. There may be some good information there that might be relevant to that question.
Yeah, and I'll look into that for Jim as soon as we're done here. I do know how to reach you, so I'll stay in touch on that. Good question.
Thank you.
Okay, other things folks would like to know? Dr. Jones, I'm so glad you talked about massive transfusion protocol, or MTP. We see the emails on our side. It's usually someone from our inventory management and distribution team that will write a message. We had an MPT at such and such hospital. We get kind of the bare information, and maintaining the patient confidentiality. But when when it's time to move units of blood and have them in place to either replace from a spike in blood utilization, or in the case of the dust storm along I-55 in early May, it turned out that patients didn't come needing blood transfusions, but we didn't know, as ambulances and paramedics were on their way to that site. And so that was another case of those IMD teams moving units of blood to make sure that we would be ready. That kind of proactive communication and response reminds how it's the blood that's already on the shelves, that was donated yesterday, last week, tested and processed and ready to be used, that makes the difference.
You're so right about that. And so it's really hard to anticipate that. We're so fortunate that the work that Impact Life does and how they keep our levels of blood supplied. We can have regular blood deliveries from Impact Life, but our utilization is not even throughout the day or through the week. And so we can always rely on Impact Life to resupply us when we're having a lot of use. For example, right here at Springfield Memorial, within the last week, we had a day in which there were 4 declared traumas that required blood transfusions. We were fortunate that none of those used massive amounts, but the collection of 4 at once. And the other thing that's very meaningful here for us in terms of use of the blood supply is we have an inpatient oncology unit where people are getting blood transfusions frequently. And we also have a busy leukemia service. So in addition to, the usual uses of blood, people who have leukemia do not form their blood cells very well because of impairments in their bone marrow. And we're frequently using red cells and platelets for those individuals. So we see a lot of fluctuation in our blood supply based on just the patient mix in our emergency room, inpatient units, and operating rooms.
Well, absolutely a reminder too on that, how when there is trauma, they may grab those units of blood that are at hand and then they're used, but that patient who was scheduled to come in for the oncology, leukemia, getting blood to help make it through and manage the cancer treatment is just as needed. And so that continual steady rate of blood donation, the reason the donor scheduling team is out there making calls, supports both ends of that. Any other questions from our reporters who are on the line? I did just, I know our media who received notice of the news conference also have a link to our news release online, but I've added that to the chat within this meeting. We do have links to B-roll and footage from around the blood center, both from blood donation and our inventory management and distribution, so you can kind of follow through on there, as well as graphics specifically for World Blood Donor Day. So you'll see those on our social media accounts. We're asking blood donors also to take pictures and post and share. And so I think that's just about all we have today. I do want to check in also with Dr. Hermelin and with Amanda Hess to say thank you for what you've had to share, but also any final thoughts. Please go ahead.
Happy World Blood Donor Day today and every day.
You bet.
Yeah, I can never reiterate the gratitude we have for our donors. They're just remarkable people who take the time out of their day. They give of themselves and they give the gift of life. Whether it's trauma season or Christmas season, we're always needing blood. And just thank you. Thank you for taking the time to hear this session and be here to spread that word. Thank you.
Oh, you bet. Yeah, that is the word of the day for all donors. For media, we will keep you informed, of course, as to how we're doing. Just as we schedule, contact donors for scheduling, we want to keep media and public informed. When we see very serious issues facing the blood supply, we are just always at work here to keep those schedules full and to keep products on the shelves that we say at our hospitals. So we'll go ahead and wrap it up and thank everyone for your participation, and we will be in touch. Take care.